Hello guys, welcome to my YouTube channel Ayurveda Basking, and today video is very special because it is for Agadatantra, and it's only have single paper, and now we have practical for this. And this whole pattern I am discussing according to the NCSM syllabus, that is given according to the NCSM syllabus. And in this video we will discuss all the aspect of our Viva and practical exam that is going to happen with you guys, and along with that the specific drug PDF and the snake PPT, like the important snake identification feature, that I will share on the Telegram channel. Along with that, the description of this video link. Okay, so all of you guys who want those PPT, they can see the description of this video, and this same PPT I am going to upload on the Telegram channel, so you all can see from that. And in this video we will discuss all the 8 aspect of our practical exam. So basically your Agada practical is constitute only of 200 marks, and this 200 marks is coming under the main 8 headings. Okay, and this 8 headings I am showing you. First heading is your sporting, and that sporting is constituting 60 mark distribution, so it is a very important portion, and it is basically the written exam. So if you do rightly and nicely write all the aspect, you can get out of 60 marks. That is very good for you guys. Then 10 marks for your record, as we already completed our records. Then 10 marks for the certificate. There will be certificate, a case scenario is given, and you have to write the certificate properly, maybe the injury certificate, that certificate, fitness certificate, all that certificate also I will share on the Telegram channel. Next, the short cases will be there according to the bite, maybe the snake bite there, vrishika bite, kita, luta bite. And 10 marks for the Agada. One Agada is there, then we have to write all the ingredient, indication of that Agada, that I also have mentioned in here, and the specific PPT regarding that Agada will share on the Telegram channel. Next is the Viva, that constitutes the 60 marks, and the Viva mark distribution I also given in this video. Next, 10 marks for elective, that we already got, and 30 marks for your internal assessment, your whole year internal assessment. Okay, so let's start our video without wasting our time. And the first portion is the sporting. So basically there are 15 specimen are there, and each of constitute the 4 marks. So basically 15 specimen along with 4 marks constitute the 60 mark distribution here. So let's see what is going to be kept in our sporting. First sporting portion is the snake. So there will be the 2 specimen, and the 1 marks for their identification, 1 marks for their poisonous or non-poisonous nature, 1 marks for their clinical sign, and 1 marks for their Ayurvedic management. So as you can see, 1 plus 1 plus 1 plus 1, so 4 marks will be there for this snake. Okay, in this PPT you can see these are the big 4 in India, that is the venomous snake responsible for most of the snake bite, spectacle cobra, that is naja, common krait, Bangarus cerulus, then Russell's viper, Deboia russelli, so-scaled viper, Aegis carinatus. So these are the 4 big 4, and the World Snake Day on July 16. Second is the differentiating feature between the poisonous and non-poisonous snake is that, first of based on their head shape. So poisonous snake have generally broad triangular head with a distinct neck, so they can easily movable their neck. But non-poisonous snake have narrow and elongated head shape, along with that the no distinct shape of the neck. Then fangs, if we talk about the fangs, this poisonous have they have a fangs, and when they bite there is a 2 deep mark properly. But in non-poisonous, fangs are absent, and there are no bite mark, but there is a multiple teeth marks is there, so we can identify, oh, this is a non-poisonous snake bite. Third point is poisonous gland. So poisonous have this poisonous gland, but non-poisonous don't have this poisonous gland. Pupil of the eyes is generally these are vertical or elliptical, but non-poisonous have round pupil, and exception is the cobra because they have a round pupil. Then ventral belly scales is broad and cover whole body in case of poisonous, but in non-poison they are narrow and do not cover the entire belly. Subcaudal scales in poisonous, they are in single row, but in non-poisonous they are in double row. As you see in the diagram, non-venomous can generally head is narrow, barely distinguishable from the neck. We can't distinguish the head and the neck portion. It is continuous, so we can say, oh, this is a non-poisonous snake. Then body is thin and narrow, and tail is tapering, and a thin point, usually never with the reds. Then uske baad venomous snake is head having a broad and triangular, as you see, like this head. Then they have a distinguishable neck from the head portion. Body is heavy, relatively fatty in appearance, and tail is blunt and usually ending in a cluster of a modified scale that's known as rattle, except in the baby snake. Okay, so this all features, if it come for 1 marks, you can write 3 or 4 feature, and you can easily distinguish due to these features. Then classical, if we talk about the classification of the snake, you can write like this. Classically, poisonous snake comes under the Sarpa visha or a Jangama visha, and their bite will produce the Ashu visha lakshana. Means when a snake bite to a person, then instant or immediately manifestation of the symptom will be there, and it mainly affect your pranavaha srotas. Then when you write in your exam, diagnose should be based on your bite marks, your clinical feature, proper history, and if there is a snake identification if available. And these are the 9 non-poisonous snake that is found in the world: green snake, gopher snake, racers, Hongin snake, rat snake, indigo snakes, king snakes, boas, and pythons. Second sporting heading is for the mineral poison or Kritrima visha, and basically there are 2 specimens, 1 from each. 1 mark for their identification, 2 marks for their identification of symptom that mimic other diseases, and that I also have mentioned in this PPT, and their method of detoxification and antidote. So as you see, these are the 4 minerals that is mentioned in our syllabus. First is your lead, then your arsenic, mercury, and copper. And here I have written all the important needed point for this. For example, lead poisoning can mimic amyotrophic lateral sclerosis or MND, motor neuron diseases, and acute porphyria anemia. And this comes under Sthavra visha, and the clinical feature you can remember with the trick, that is a short trick: ABCDEPS. A for anemia, B for basophilic stripling, or B for Bartonian line that find in the lead poisoning, it's known as plumbism also. C for colicky or constipation, D for wrist drop or foot drop, E for encephalopathy, P for paleness of the face, and S for stiffness. So this is the trick you can remember maximum clinical feature of the lead. Second is your arsenic. It can mimic the food poisoning because gastroenteritis complaint will be there, and it can mimic the cholera because rice water stool is there. Acute organ failure, neurological symptom can also come, or it can also mimic the cancer symptom. And the trick for remembering the clinical feature is arsenic itself, arsenic G cube. So arsenic, A for aldrich rhine, R for 4R raindrop, red velvety appearance of stomach mucosa on the postmortem appearance, S for subendothelial hemorrhage, E for excessive pigmentation of palm and sole, N for necrosis, I for iron. Actually ferric chloride is the antidote for this arsenic poisoning. C for then arsenic, G for garlicky smell, and G cube is golden hair. So and these are the all main clinical feature you are going to see in arsenic poisoning. Third one is your mercury. Mercury can mimic your neurodegenerative diseases like Parkinson, Alzheimer, or autoimmune diseases. And the trick to remember clinical feature is battle. B for brown malt appearance complex. A for acrodyna because pink disease. It will make you pinky appearance, so acrodyna. T for tremors. T for tonicity, it will decrease the tonicity of your muscles to make hypotonic. L for lens affected, it will affect your lens of the eye. And E for erytherism. And next comes the copper. Copper, the trick is simple copper. C for colicky, O for oligouria, P for paralysis, P for perspiration, E for emesis, R for rhabdomyolysis. And the trick, like it can mimic the symptoms like hepatitis, acute liver failure, or cirrhosis. And this the specimen seen in this PPT is the copper sulfate. Okay. And in Kritrima Visha, basically these are the Kritrima Visha that is mentioned in our syllabus: inorganic acid, organic acid, alkali. So out of this they can kept any one of the specimen. You have to correctly, first of all you have to identify it correctly. Okay, so the PPT I am going to share in the description of the video. You will see maximum of this specimen and you can identify them easily. And here this one of the chart that is mentioning about acid and alkali with their action, symptom, fatal dose, fatal period, management, post-mortem appearance and medico-legal aspect. You can read from this PPT. This is for the metallic poison, this is for the CNS depressant, this is for asphyxiant. And the third portion of the spotting is the toxic plant. As you know, we have several toxic plants like Vatsanaba, Carvera and all. So there will be 2 specimens from that portion. And first point is identification with the scientific name. You have to write your botanical name, then family, and you have to write the Sanskrit name of that particular plant. For example, if any plant will come, like if your Vatsanaba came, then you have to write its botanical name, its family like Renan Kulesi, and its Sanskrit name Vatsanaba. Second point is mode of use in Visha, like how they can use as a Visha. For example, Bhallatka have very special thing, and this Vatsanaba is work as a cardiotoxic. All those things you have to mention in that second portion. And the third portion is detoxification method, like how we can detoxify them and use in Ayurvedic formulation. Because as you know, since Vatsanaba is a cardiac toxin, but it is used in many of the formulation, and it is good, like it is having the perspiration property, Javaragana property, Shothara property. So that's why we are using it in many of the formulation, but in a very less dose and after its purification. So they can ask the what is the detoxification method of that particular drug, and along with that is active principle and antidote that is used against that specimen. Okay, so here I have written all these key essential points. For example, Vatsanaba is your aconitin parox. It contains aconitin, pseudoaconitin, picroaconitin, and it acts as a cardiac poison. Then these are the symptoms: sweaty state, nausea, vomiting, vertigo. Along with that is fatal dose, fatal period. Management is basically the stomach voce and post-mortem appearance and medico-legal aspect. So which are given in our syllabus, I have written only for those, like Vatsanaba is given, tobacco is given, digitalis is given, then Caravera is important. So here Vatsanaba is important, tobacco maybe can come, but in Kerala generally its plant is not found, so maybe it's a wet specimen is not found. Then Caravera can come. Then next comes Kupilu is important. Next, Ahifena maybe the dry specimen or the store specimen can be. This is about the toxic plant. Next come the so up to here you can see this Ballatka, Arka, Snowy, Langli, all are important. And next come the antitoxic plant. So there will be 3 specimens from the antitoxic plant, and these are the main heading that can be asked. First is the identification along with their botanical name, family, Sanskrit name, and their mode of use in the Visha, like why we are using them at the antitoxic plant. And third one is their active principle and their important formulation. So in syllabus actually mainly there are 12 main antitoxic plant that is given, and I have mentioned all of them along with that their particular important formulation. So when you go to this PPT you can see this point from here. Next comes the injury portion. So there will be 2 specimens. First is if injury comes, then you have to identify the injury. If any weapon come, you have to identify that particular weapon. Along with that is criminal act that causing that particular injury. Okay, and the next portion is their medical legal. So this is the main 3 heading that is coming from injury portion, and total 4 marks. So here you can see these are the type of hammers. Sometimes hammer is kept, so you should name correctly the hammer. Maybe it's a claw hammer or a ball pin hammer, or a sledgehammer, or a dead blow hammer. Then this is some of the injury picture I have given here. First, this is for the strangulation, and this is for throttling. In that PPT all this will be there, so you can easily see from that PPT. This is for suicidal wound. This is for multiple incised wound. Next comes, this is for hanging, and this is for RTA. Okay, so here some of the portion I have written is that the identification of weapon. For example, if injury like abrasion came, then you have to write some feature of that particular injury. For example, in abrasion, there will be the loss of the superficial loss of the skin, and skin become reddish, scab formation will be there, no profuse bleeding is there, and abrasion generally come in IPC 1860, voluntarily causing hurt, section 323. Then criminal act, it may be the fall, it may be the dragging, it may be the RT, or it may be the assault with the blunt object. Second, contusion, lacerated wound. All the important needed information I have added here. If any of this injury come, you can write all these things neatly. Okay, and last there is one exam tip also. For example, here you can see generally when there is a clean cut wound, then it will be through the sharp weapon. If a irregular wound with the tissue bridges, it is through the blunt weapon. If depth is more than the length, that is a stab wound. If bone cut injury is there, that is a chopping type of weapon. If a horizontal neck mark, then it is a strangulation. If it's a oblique, that is a hanging. And whenever you are writing the injury question, don't write the definitive statement. Only start with injury is constituent with the assault of dash weapon. This will give a more good presentation to your paper. The sixth point is that about some cuttings. Okay, so basically in our syllabus it is mentioned there should be some newspaper cuttings, and along with that you have to identify the medical legal aspect, or you can see some case scenario, and two specimen will be there. First you have to identify the crime scene, then you have to write the relevant IPC or CRPC section associated with that crime that constitute 1 marks, or third heading is relevant actor related to that crime you have to add. Like this like this kind of paper cutting will be there. Then you have to infer it may be the dowry case, it may be the rape case, or it may be the accident case, or it may be any like injury case, or it may be the sexual offense case. So like that you have to first of all assess which type of injury or which type of crime scene is there. So here I have written some of things. For example, the case is like that. A young married woman was found dead in her house with extensive burn injuries within 2 years of marriage. Neighbor report frequent harassment for dowry. Okay, so we know this is a dowry case. So first of all you identify the crime, that is the dowry death, section 304B IPC. Then medical legal importance, unnatural death of a married woman within the 7 years of marriage, and there will be mandatory post-mortem should be done, inquest by the executive magistrate, presumption under the law against husband or in-laws. Second specimen you can see, a man was found hanging from the ceiling fan in a locked room, no sign of struggle were found, and suicidal note required. Okay, so we can oh, this is a suicidal case because no struggle is there and he is locked inside a room. So medical legal importance, unnatural death, so medical legal case, differentiation from the strangulation, and police inquest. So these are the some of more common exam scenario I've written. First, for acid thrown, and that acid attack comes section 326A IPC. Second scenario is child with genital injury, so that comes under the sexual assault or POSCO Act. Third one is death after consuming pesticide, that comes under suicide or homicidal poisoning, or maybe the accidental poisoning. Fourth one scenario is the woman dies during the delivery due to the negligence, that comes under the medical negligence. Next one is hit and run road cases, so it may be the RTA, rashes and negligent driving, section 279 IPC. So these some of the one important things is dowry death comes under 304B IPC. Burn injury in a married woman suspicious or dowry related, hanging in a locked room generally suicidal, acid attack is hurt with the corrosive substances and that can cause a grievous injury, so section 320 and 26 can come. Then sexual harassment, assault in child, POSCO Act. Okay, then whenever this kind of question comes, don't give judgmental, right, like the case amount to be suspected, like this case. Okay, then relevant IPC and CRP I have already mentioned. You can remember, if you can remember, you can remember from this table. Next one is this, all like the things, sexual offense against a child comes under POSCO Act. Then what will be the punishment, then acid attack, then consumer protection, domestic violence, and this is the major thing you can remember. And if it come for 1 marks, then you just write the section number. If it come for 2 marks, you can write the punishment also. Okay, seventh portion is coming for the Jangama visha. and basically our Sarpa Visha, Luta Visha, Vrishchika, that all are coming in Jangama Visha. So first portion is identification, carry 1 marks. Second is their Adhisthana or Samanya Lakshana or Chikitsa. Third point is specific formulation, and that constitutes 1 mark. Okay. So for this portion you can see in our PPT in which major the specimen is marked, so you can remember from those. And generally we know this is a Sarpa and all, but you have to remember their Samanya Lakshana. That is important. In Ayurveda generally shloka and all are there. If you can remember shloka, that is very good. And if you remember in the exam and you can easily like recollect that thing, you can write that thing also. And specific formulation you just study or doses. Okay. Second portion is, so first this all are coming for the sporting, that constitutes 60 marks we completed. Okay. Second portion is your practical record, that constitutes the 10 marks you have already submitted, and hope so it is signed by the HOD and all department. Then the third subheading is the medical and medical legal certificate. Okay, so basically some case scenario, or directly they can say, oh, you write the fitness certificate. Then we have to write properly according to the format, and the format we are following I will share in the group. Okay, so medical legal certificate will be there, and this will basically case scenario based maybe. Okay. So here like I have written some case scenario. Injury certificate, a 25-year-old male present with the pain and swelling over the right forearm after the alleged assault. So it is, we have to give injury certificate. And if a case scenario is like that, a student suffering from the fever and advised test for 5 days, then he should take a medical certificate. Okay, or sickness certificate, medical certificate for sickness. Fourth heading is the short case scenario. So this is also very important. Okay, and I think this is for 10 marks. So there may be 1 or 2 short case scenario will be there along with picture, and you have to diagnose a specific case poisoning. Okay, it may be the Sarpa Visha, it may be the Luta Visha, it may be the Vrishchika Visha, or you have to give the answer of that specific question. Like question will be, and you know, in here question are also written. First, clinical examination, which clinical examination you will do to confirm it. Then what are the major investigation, what is the treatment, what is the prognosis, and they can ask the differential diagnosis also. So here I have written for the Kita Damsha. So one Kita is there, or snake bite case, insect bite case will be there, and the feature is a small erythematous swelling on the forearm with the central puncture mark, mild edema and redness. So a 25-year-old female present with the sudden onset, local pain, itching is there, mild swelling at the site, no systemic symptom but history of insect bite while sleeping. So diagnosis Kita Damsha. Classification, it comes in Jangama Visha and Alpa Visha, usually Kapha Pitta Pradhana. Clinical feature is Kandu, Toda, Shodha, Raga, rarely Javra. Investigation generally that much not required, but CBC, secondary infection suspected. Treatment will be the Visha Avsadhana, Lepa, Shita Upchara or Agada, Vishaghana Lepa, and according to symptomatic relief can be given. Then prognosis you can write. Second case I have written for Vrishchika, like that some case scenario surely will be there, you have to correctly identify. And this some example you can see from our PPT. One of the case I have written for Alarka Damsha, rabbit dog bite, that is also important. Okay, and given in syllabus also. Fifth heading is the clinical application of Agada. So basically in our syllabus these are the main 5 Agada mentioned: Dushi Vishahari, Vilvadi, Dashanga, Murvadi and Panchashirisha. So first portion will be the, you have to identify the Agada which you will select for that particular case scenario, that constitute 2 marks. Or maybe like ingredient are given, like they will ask which one Agada that having this specific ingredient. Then the 8 mark constitute the, you have to write the scientific name and the sub question based on that particular preparation. Maybe for example, if Agada having the 10 ingredient, then you have to write the botanical name and family of the 10 ingredient, which part we are using in that particular Agada, the procedure, the indication, or maybe some modern correlation. Okay. Sixth portion is our Viva, and this Viva is basically of 60 marks. Okay, 10 marks from the Agadatantra basic and all, like your syllabus that you written in your exam. Second is for the forensic science or Vyavahar Ayurveda. Okay, then jurisprudence, Vidhi Vyakhyam and toxicology. and concept of Agadatantra and cancer and substance abuses, one question from each topic. So this there is 50 marks. Then 10 marks Viva from the compilation. We have submitted one compilation on Agada. On that there may be 10 marks Viva and 10 marks for your elective that you already got, so no need for that, and 30 you already got for your internal assessment of the whole year. So this is the whole like 200 marks paper distribution we have seen, and the maximum information I can give I have provided in the video. Hope so all of you like it, and you because if you study this whole thing nicely you can write maximally. Okay, and our target is mainly at least we got 150 plus in our exam in practical. And I have already told you the Agada PPT I am sharing on the Telegram. Okay, then Agada drug or the specimen, for example the by snake and all specimen, that I will share on the our Telegram channel. And one more thing is there, I think certificate that I will share also on the Telegram, so you can download that PPT from there, and this specific PDF I will link the description of this video. So thank you guys.